Response Biomedical's latest generation instrument, the RAMP 200, is a rapid testing analyzer with results averaging 15 minutes across the RAMP test menu. The RAMP 200 requires no calibration or maintenance and has been optimized for clinical use to help enhance patient care, improve operational efficiency, and provide a rapid turnaround time without compromising quality. The RAMP 200 can be used for the testing of cardiac biomarkers and infectious disease markers in a laboratory setting, as well as a number of non-clinical tests for biodefense and environmental applications. In this presentation, we will discuss the main benefits of the RAMP 200 and demonstrate how easy it is to run a RAMP test in 3 simple steps. In its basic configuration, one control module can be attached to a single test module to run 2 tests in parallel, or it may be expanded to run up to 3 test modules or 6 tests simultaneously. An internal quality control check, or IQC, is automatically performed upon reader startup. It takes less than a minute to complete and can be programmed to run at set intervals or run manually at any time. The control module has a bright, easy-to-read touchscreen interface for easy menu navigation. With multi-language capability, enhanced data management and connectivity, the RAMP 200 has optimal flexibility to run multiple tests on the same or different patients simultaneously. Each test kit contains the required components to perform 25 tests. To run a test, an EDTA whole blood sample is required, in addition to 1 test pouch and 1 buffer vial. Within the pouch, you will find 1 cartridge and 1 test tip that contains the fluorescently bound antibodies. The test cartridge is barcoded to tell the reader the lot number, name of the test, and which calibration file to access. There is no need to centrifuge samples, as the sample type for all RAMP cardiovascular tests is EDTA whole blood. To run a test, select Run Assay on the touchscreen display. Enter the patient details manually or by using the barcode scanner. Attach the test tip to the pre-calibrated transfer device provided to measure exactly 75 microliters of sample. Draw the patient sample and mix with the specially formulated buffer. In this step, the binding of the antibody to the antigen is already occurring prior to addition of the sample to the cartridge. The buffer has been formulated to optimize the interaction between the antibody and the biomarker and to minimize the influence of interfering substances in the patient sample. Once well mixed, dispense 75 microliters of mixed sample into the cartridge well. Insert the cartridge into the appropriate port until firm resistance is felt. The reader does the rest. The reader will scan the barcode and also ensure the detection of sample flow. As the sample flows from one end of the cartridge to the other, it encounters 2 zones. The detection zone, which measures bound particles when the biomarker is present, and the control zone, which measures the unbound particles. The reader measures fluorescence at both zones and, using a proprietary algorithm, calculates a ratio between the 2 values. This ratio is called the RAMP ratio. The RAMP ratio corrects for sources of variability such as sample volume, user variability, environmental conditions, and reader movement, providing enhanced precision and accuracy to your test results. While the test is running, a timer is displayed on the port icon indicating the time to result. A simple touch of the icon will display the patient information, additional information about the test being run, and the operator who performed the test. Refrigerated liquid quality control materials, or LQC, are also available for all cardiovascular tests. These samples may be used to train new operators, validate new instruments, as well as for routine QC testing to meet the quality control requirements mandated by your facility. Due to the innovative plug-and-play design of the RAMP 200, test modules may be added at any time to expand your test volume, increasing throughput to up to 36 tests per hour. Furthermore, a user can enable additional security features that have been built into the system. Among them, operator supervisor level accessibility and password security, operator lockout, normal range setting, control ranges, and control over patient-specific notes. The reader converts the RAMP ratio into a numerical result that is displayed on the screen and stored in memory. The RAMP 200 can store up to 900 total results, and results may be printed automatically onto labels for easy charting, exported to a USB key, or uploaded to the laboratory information system in a networked environment. In summary, the RAMP 200 is a rapid, easy-to-use reader with excellent compliance and quality features. Through its modular, flexible design, the reader can be configured to meet any laboratory's needs. For further information on the RAMP 200 or on the RAMP portfolio of tests, please visit our website at responsebio.com.